Public Accounts Committee on distribution of ventilators to county hospitals which had no ICU facilities. Mochache also told the committee that the ministry was not a member of the task force on COVID-19 funds, as members questioned how the task force operated without directives from the ministry.
It was a date for the Health Principal Secretary Dr. Susan Mochache before the National Assembly Public Accounts Committee unearthing the COVID-19 expenditure, Mochache taking members of Parliament by surprise when she admitted that the Ministry of Health was not part of the COVID-19 task force on COVID-19 funds, members questioning its operationalization without directives from the ministry.
They would buy on their behalf and distribute.
Was there a member from the Ministry of Health in that committee?
No, we were not involved.
So that board, that committee, calling it a committee, a board, or a fund, you see, on matters of health, how would they have been operating independently out there without reference to the Ministry of Health, the PS, specifically, who is the accounting officer?
I'm sorry, Chair, but we were not involved in there. All we know is that they were giving support to the counties.
The COVID thing, the people, in fact, if there are people who are known in this country, it is your ministry. I mean, you're on TV every day. So how come these billions which were raised in fighting COVID, the Ministry of Health is not involved? I mean, to me, that's very strange.
You see, it's a private sector initiative.
And I'm sure, no. I am sure, PS, I mean, you have some information.
Mochache landed in deep trouble when she told the committee that the distribution of 75 ventilators to various hospitals in the country to help fight COVID-19 was guided by a report of technical committee inaugurated by the Ministry of Health. PS Mochache told the Watchdog Committee that the technical committee recommendations were based on study across the country to assess the status of the hospitals earmarked to receive the ventilators.
Now we have raised them to almost 2,000 ICUs.
So why do we take the ventilators? Why do we pay for ventilators? You know, I think you buy things on user basis. Why do you take a ventilator when you know you have no ICU? Why couldn't you even take it to a hospital where there's ICU that had the facility, or to dump some of them in hospitals that had no ICU? I mean, this is a moral question, Madam PS.
And again, just as you answer, Madam PS, if you look at the report keenly, the task force report, which we have now found, we don't seem to see anywhere they are talking about, they are making any recommendation on Mama Lucy Kibaki and Ruiru level 4. They are missing in this report.
Because, Chair, why I say no, that is not possible, is because, Chair, at that time, this is the early day of COVID, people believed that what was needed to save lives was ventilators. In fact, there was a complete shift across the globe from ventilators to oxygen supply. So it became very obvious that if you have COVID, you actually needed oxygen rather than the ventilator.
The special audit shows that out of 11 hospitals that received the ventilators, 6 could not use them to save lives because they did not have technical capacity or did not have a special storage rooms. With Health Principal Secretary Dr. Susan Mochache having told the committee that they were not part of the Public Trust Fund on COVID-19, now the much awaited is the response from the CS and the Attorney General. Elizabeth Motuko, TV 47 Pound Buildings, Nairobi.